Hi, I'm Kylie Tucker. I'll be doing a cerebrovascular accident physical examination. Here is my prep table, and I've got my picture ID right there, my license plate, my license number, and then I've already washed my hands over there on that sink, and I'm gonna come over and reposition my phone. Okay, so here's my volunteer patient with cerebrovascular accident, and I've already washed my hands, so I'm ready to come and assess my patient. So EMS is the one that brought her because her family had called because she was exhibiting some of the stroke symptoms, which is a facial droop, arm weakness, and she has speech deficit. So anyway, her family was really worried. They brought her in because they were in moderate distress and they were wanting to reverse some of these symptoms. So my patient is in her 60s. She looks like she has adequate hygiene. She's a little disheveled just from the traumatic event. So because we're thinking it could be a stroke, I want to do a head CT so we can test to see if it's an ischemic versus a hemorrhagic stroke. Because if it's ischemic, we want to be able to start that TPA within 90 minutes. It's kind of known as our golden hour, so that we can kind of reverse some of these symptoms that have occurred. So my three systems and regions that I'm going to be assessing would be the eyes and ears region, the motor musculoskeletal system, and the sensory neurological system. So with the eyes and ears, well, I want to grab my pen light over. So I will have my patient follow the tip of the pen so I can assess the 6 cardinal fields, just to kind of see if she's able to follow the tip and if her eyes have good coordination. So because her right side of the body has been affected from the stroke, her right eye is just kind of a little like sluggish movement. And then I want to check for pupillary reaction, so I'll turn on my pen light here and just kind of assess to see if her pupils are reactive. And it looks like her right one's just still sluggish. And then because stroke also affects your peripheral vision, I'll have her look straight ahead and see if she can see the number that I put on the side. So because it's her right side that is affected, she cannot see her peripheral vision, so she doesn't know the number. But on this side, she can tell that it's a number 2. So I know her eyes are good, and I will also want to make sure I assess her level of consciousness. So I will want to come and ask her, hey, do you know what your name is?
Yeah, there.
Okay, so she's experiencing very much slurred speech, so I'll ask her, I'll keep wanting to know her orientation level. So do you know the date?
I am.
Okay. Do you know your date of birth?
I am.
Okay, do you know who the President of the United States is? Okay, so my patient is experiencing slurred speech, and so because I'm not able to understand or comprehend the words that she's trying to communicate to me, so she has an altered level of consciousness as far as I know, because she's unoriented times 4. So then I know that, and then I will want to check, and just to kind of see, I want to check her ears and make sure if she has any cerebrospinal fluid coming out, because she might have experienced some head trauma when she started experiencing these stroke symptoms before family called EMS. And so she doesn't have any cerebrospinal fluid coming out, so I know she's not experiencing head trauma. So, and then I will want to assess my motor musculoskeletal system. So I'm just going to check for her posture. I already looked. Her spine is in a good position. It has good alignment, and then I'm going to have her sitting upright. If she needs an extra pillow because she's kind of drooping to her right side, I'm going to provide an extra pillow for support. But this chair has nice cushions that she's not stooping over. And then I know when she was brought in, she was not able to walk, so we just had to do a log roll, and then she needs help with assistance to transfer because she has that right-sided droop. She cannot stand, put weight on her right foot, or she would fall without assistance. So she's not able to perform the heel-to-toe walk assessment, but I know that it's impaired at the moment because she is not experiencing good motor movement in her right side. And then I will want her to do, so I'm going to put my finger here. She's going to do a finger to her nose with her left hand first, which she's able to do correctly because it's not affected with the stroke. Okay, and then she's going to try and do it with her right hand, but she can't pick it up just because she's experiencing the weakness. So you see she's trying because I'm asking her to touch my finger to her nose, but she can't quite get it there. So I know she's having her right hand even in her movement. So then we'll want her to do thumb to finger approach in all of them. So we'll start with her left hand, which she's able to do appropriately, just kind of assessing range of motion. And then I'll want her to do it in her right hand, but she's unable to touch her fingers because she doesn't have that full range of motion in her fingertips, that fine motor movement. I'll want her to lift up her arms to kind of assess any arm deficits, which she can lift up her left one all the way, but her right one just like she's trying, but she can't get it up. So I know she's got a pronator drift. And then I'll want to assess like all of her extremities for any redness, swelling, or any bruising or anything that she might have going on. But I don't see any abnormalities as far as that goes. And then I will want her to do some leg kicks. So we'll have her do her left side first, but she can touch my hand, okay? And then she's going to try her right one, but she can't pick it up all the way. So I know she's unable to do the straight up leg kicks. And then I'll want her to squeeze my fingers really hard. So that one she can. This one I have to go down to her, but she still can't squeeze my fingers. But this one she's got great strength in. So then I assessed all of her extremities. And the range of motion. And then the sensory neurological system. So we've already assessed her LOC, so I know that she's got some altered level of consciousness. She has experienced some impulsive behavior, so we just kind of have to remind her that she needs to stay in the chair because she's not strong enough to perform or to walk or do any ADLs at the moment. So I know she's got impaired memory, but when I talked with her family, they kind of filled me in the details of the events that's happened today. And because there's a speech deficit, she can't communicate very well, and then I know when I've asked her mathematical questions, she's unable to respond with an answer. So anyway, and then I will want her to do a shoulder shrug to see if they're gonna do this. So she's able to on her left side, but her right side she can't get her shoulder up. So I know that the stroke has affected her her cranial nerve 11, the accessory nerve. And then I'll want her to stick out her tongue so I can see any deviations, but it looks good. She's experiencing the facial droop on her right side though, but other than that, it's been good. And so I want to assess with the 2-point discrimination, and the point to point. So I'll just kind of touch her like a cotton ball, see if she can tell if it's soft versus pointy. See if she can kind of see the difference between the two things. So I want to do it on her cheek and her forehead, just kind of assessing it, and then her chin, jawline, and the pointy. Which she's able to feel the difference on her left side, but her right side she cannot tell the difference between my pointy object and my cotton ball. And then I'll want to do the 2-point discrimination, so I'll just kind of do 1 point versus my 2 points. So we'll just kind of do it like on her arm. We'll do this one. Is that 2 points? She's shaking her head, yes, okay. And is that 1 point? Yep. Okay, is this 1 point? No. Okay, so she's able to get that right. I'm just being tricky, trying to trick her. So if I'm coming on this side, is this 2 points? She doesn't know because she can't feel it on her right side of the body for that 2-point discrimination. And so then I will want to make sure. So after I've assessed that, I'm going to want to assess both sides, and I'm going to assess her leg, the same thing, to see if she can kind of tell the difference between my 1-point, 2-point discrimination points. Okay, and then after that, we're going to assess for reflexes. So I will want to assess for the brachioradialis. So this one, you just kind of want to support the patient, and then I'm going to use my reflex hammer and hit here, and see if I can get a reflex. But because this is a side effect or a stroke, I'm not seeing any visualization. But then I'll come on this side when I do it, and I check for the brachioradialis here, and it moves a little bit. And then I'm going to want to check the tricep. So with this one, I want to support her arm to make sure I get it. So just kind of have it hanging right here. And then I'm going to grab this and hit here and see if she moves. And then we'll come on this side. See if she moves. Okay, so she moved a little bit. And then I want to check the patella. So this one, I just want to hit right below the patella to kind of see if I can get a reflex here. That one I didn't. And this one, okay, so I got a little bit of a reflex there in that one. And then I want to also check the Achilles. So you're just kind of supporting the foot and then you're hitting back here to see if you can get that Achilles tendon reflex. Okay, and then, oh yes, and then the bicep one. So you're just kind of supporting her arm and then you hit here just below the biceps. Okay, so she did have a little bit of a reflex. So now I'm going to set that down. Let's see. And then I know with stroke you have some kind of eating impairment. So I know I've gotten, so I'll also test her finger nerves with this taste. So I'll have her eat a cracker. I'll give it to her strong hand, see if she can eat it. And then you're just checking to see if she's able to eat it, if she can taste the object, and then if she's able to swallow adequately. Because a lot of times with stroke, they'll like pocket food in this side where it's affected the stroke. So she does have a little bit of pocketing, but for the most part, she's able to swallow. But to be safe, I will also want to, after she tries a bite, I'll have the speech pathologist follow up with her as well. Anyway, that is my physical examination for the cerebrovascular accident.